Hi, I'm Ken Howard, and those of you that don't know me, I've been a gay men's specialist, psychotherapist, and coach for 34 years now. And I've been getting messages and emails and stuff from folks saying, dude, you're this long-term therapist for gay men. What do you think of the uh, Supreme Court decision this week about striking down the ban on reparative therapy? And obviously, it's very upsetting because to legitimate therapists who give gay affirmative therapy, hearing about reparative therapy or conversion therapy is really anathema, and those techniques were banned for a reason. One opinion that I wanted to give that I don't think other people are, I mean, yes, it's harmful and that's awful. Yes, I would add to that how therapists are regulated and how therapists are taught. Now, in addition to my private practice, a while ago, I've retired now, but I was a professor, an adjunct associate professor at USC in their School of Social Work, the Graduate School of Social Work. And I taught several courses, one on LGBT issues, one on couples therapy, but another one on psychotherapy technique, which was called evidence-based practice. What that means is that it's psychotherapy techniques that have been proven through formal academic research and clinical research to be legitimate, to do what they say. It's not just snake oil, it's not just bullshit. It's found through research to be helpful for what they purported to be helpful for, such as trauma or anxiety or depression or OCD and so on. And I've supervised a lot of young therapists who were early in their practice. And the state boards, there's a state board that governs therapists of all kinds in every state. And these state boards have the power appropriately to regulate how therapists work. They're really, in California, the Board of Behavioral Sciences, which includes social workers, LMFTs, and others, LPCCs, they have the right and the duty, really, to regulate therapists. If a therapist is found to be unethical or incompetent, they could lose their license or have it suspended or whatever. And there's rules about that. You can't just say or do anything as a therapist to a client or a patient. I use both those terms like you would in real life. I do lots of things in real life. I make jokes or whatever. Um, Not that I don't make jokes in therapy, but it's the things that you say, your free speech as an individual are different from the things that you say in the context of conducting verbal talk psychotherapy. And that's true for psychotherapists. It's also true, of course, for healthcare providers, for MDs and DOs and nurse practitioners and PAs. They can't say things, free speech, to a patient that would be harmful. Like if a patient said, I'm overweight and apparently on the verge of diabetes. What do you think, doc? And the doctor says, well, I'm partial to baked goods. So I think you ought to enjoy yourself. I think you ought to eat all the cake that you possibly can because I like cake. Maybe you like cake. Let's just all have cake. Now, what happens? The person might take that advice and eat a lot of cake, and then they do get diabetes, and then they suffer from the complications of it. Well, the doctor said, you know, or the doctor could say, I have free speech. I can tell that patient to eat cake if they want to. I like cake. We all like cake. Let's just eat cake. That's not sound medical practice. We would look at that and say, what kind of a quack doctor is that telling this patient bad advice? All right, well, let's bring it back to the reparative therapy example. I think you should hate yourself for being gay, and I think that you should pray to God to change you, and I think that you should ignore all of your natural sexual expression instincts, and you should force yourself to do sexual behaviors that aren't in line with who you are. Okay, that's very kind of eat cake-ish, And the California Department of Consumer Affairs and its Board of Behavioral Sciences have a legal right to regulate what therapists say so that consumers in California or whatever state, are not harmed. They don't have the diabetes and have complications. So if therapists have an obligation and doctors have an obligation to give sound advice in the context of the patient room, either in telehealth like I do or in a session room in an office, then it starts to regulate their free speech. And that's the point of conversion therapy bans, is banning a therapist saying something to a client that has been known, not just theorized, but known to cause harm to many, many, many people. So that's my take on it. And this is why, even though the law might start to say that therapists can practice conversion therapy, that's a religious practice. That's not a secular psychotherapy practice. What's a Christian appendectomy? I don't like Christian counseling because I think counseling is a secular science, cognitive behavioral therapy, psychodynamic therapy, and so on. But if you want to incorporate spirituality, okay, maybe there's a place for that. But proselytizing or using your religion to supplant legitimate psychotherapy interventions, what a therapist says to a patient or client is called an intervention. And there's different intervention models, especially the evidence-based practice ones. And so if therapists aren't practicing within the confines of what the state board has the prerogative to set, the standards and the ethical and legal parameters, then they shouldn't be a licensed therapist. They should be a preacher or some type of person who works in a church. And this harm that comes to people, especially gay men, but there's been others too, and trans people, it's not made better because little girly girl, little Katie or whatever her name is in Colorado, just because she's this perky little female and wrapped up in female sugar and spice and everything nice, that doesn't make it any less vicious. Women can be vicious too. And little perky little girls like Katie, that's not benevolent. That's not love. That's not Christian love. And it's certainly not the compassion that a therapist might bring. That is a vicious, obnoxious self-indulgence to control people according to your values. And it's sadistic to make them hate themselves or even commit suicide by what you're telling them to do. That is not benevolent at all. That is vicious. And we need to call it out as vicious and as harmful. And we need to fight that because people have a right not to be put in harm's way in that way. So this isn't over. As the Cher Diane Warren song says, this is far from over. You haven't seen the last of me. And that's what I say about the Supreme Court ruling. And that's what I say about the importance of keeping legitimate therapy to consumers.